Hello everyone and welcome to another edition of our anatomy class. In today's class we are going to discuss the first cervical vertebra, which is also known as the atlas. It is an atypical cervical vertebra. It has many particular and special features which we are going to go through. Trying to cover everything within a short class is almost impossible, but we will try our best. First, let us take a preliminary look at the atlas. Here it is, right in front of you, and you can see at the beginning that it's different from the other cervical vertebra that you've been looking at. If you look at the typical cervical vertebra, which is this one, you will see that it's quite different, and what strikes you immediately is that it's ring shaped and it does not have a body. You can see the body of the cervical vertebra here, but you can't see any body in the atlas. So it's ring shaped, and the ring has got a small anterior arch, it has got a much longer posterior arch, it has these two chunky bony masses which are each known as the lateral mass, and it has a transverse process, and it has a hole in the transverse process called the foramen transversarium, and the tip of the transverse process, instead of having both an anterior and posterior tubercles, the tubercles appear to be fused into a single entity. And you can make out the superior articular facets over here on the upper surfaces of the lateral mass. You can make out the inferior articular facets over here on the lower surface of the lateral mass. And now let us look at these things on the drawing behind me. See here, this is a picture of the atlas, a schematic, and this is the small anterior arch, this is the much longer posterior arch, and these are the superior pair of articular facets looking from the upper surface, and you have the foramen transversarium over here, the foramen transversarium over here, and the transverse process right here. Now let's take a closer look again. Look at the anterior arch. You can see that this very small anterior arch, it has got an upper margin or an upper border, it has got a lower border, it has got an anterior surface with a prominence in the middle of it, which is called the anterior tubercle, and you have two depressions by the side of it. You look at the posterior surface of the anterior arch and you can see that it has a facet over here, and this facet is meant for articulation with the odontoid process or the peg of the axis to form the medial part of the atlantoaxial joint. Now let's see where the axis is. Here we have the axis for you. This is the odontoid process. You articulate the odontoid process and this is what it looks like. So you have the medial part of the atlantoaxial joint, and of course on the sides these are the lateral parts of the atlantoaxial joint. Now coming back, so we have seen anterior arch, we have seen the upper border, the lower border, anterior surface with the anterior tubercle, and the posterior surface with a facet for articulation with the odontoid process of the axis. Now you look at the posterior arch. The posterior arch is quite long, it's much larger than the anterior arch. It again has an upper border or an upper margin, it has a lower border, it has a posterior surface, and this elevation on the posterior surface is the posterior tubercle, and it has an anterior surface, and on this anterior surface you can make out a groove over here. This groove, which has been converted into a tunnel. See this hole over here, this opening, this was actually a groove converted into a tunnel, and this groove is called the sulcus for the vertebral artery. And let's see if we have another specimen in which you don't have a groove. See, this is another specimen of the atlas. Here on the posterior arch you see that there is just a groove, there is no tunnel over here, there is no hole, but on this specimen this groove has been converted into a tunnel. So this is the groove for the vertebral artery, or the sulcus for the vertebral artery. So after the anterior and the posterior arch, let us come to the lateral masses. You can see the lateral mass bears a pair of superior articular facets above and a pair of inferior articular facets below. The inferior articular facets are more or less oval. but the superior articular facets are quite elongated. They might also be bean shaped or kidney shaped, or they might be split into two facets. If you look at the medial surface or the inner surface of the lateral mass, you can see small projections, one here, one here. These tubercles are giving rise to the transverse ligament of the atlas. This transverse ligament of the atlas is meant again to hold the odontoid process of the axis in position. So you have a transverse ligament somewhat like this, holding the odontoid process of the axis in position. Now if we go beyond the transverse process, beyond the lateral mass, we come to the transverse process, and in the transverse process you can see this foramen transversarium. Foramen transversarium, anteriorly it appears slightly incomplete, and laterally the transverse process is quite a big entity, and the thing is that the distance between these two transverse processes is the maximum for any of the vertebra, and these transverse processes are so far apart that you can feel them in the neck in a lean and thin person between the angle of the mandible and the mastoid process deep inside over here. I can't feel it myself, but I suppose in a very lean and thin individual you might be able to feel the tip of the transverse process. The tip of the transverse process of the atlas is also one of the so-called surface marking points for the accessory nerve. Anyway, let's come back to this. So this is the transverse process, and you can see the gap over here. Actually, the place where you see the gap, it is the costal element of the transverse process, and the remaining whole thing is the transverse element. So this gap usually appears within the costal element, but not in all specimens. You see, in the second specimen that we have here, you can't see the gap. So the foramen transversarium has got a full margin, okay, over here. Now if we can go back to our picture, see, we had seen the anterior arch over here, the small anterior arch with the anterior tubercle over here, and on the posterior surface of the anterior arch here is the facet for the odontoid process of the axis. Here you can see the posterior arch, and this is the upper border of the posterior arch, this is the lower border of the posterior arch, and here is the groove for the vertebral artery, and here we have drawn the vertebral artery and you can see the groove, and on the posterior surface of the posterior arch you can make out the posterior tubercle over here. If you go to the lateral mass, you can see the superior articular facet elongated. Anteriorly it is closer to the midline, posteriorly it's away from the midline, so the long axis is oblique, and you can see on the medial surface of this articular facet, it's below this facet actually, it's on the medial surface of the lateral mass. You can see these tubercles giving attachment to the transverse ligament of the atlas. Passing further laterally, you can see the foramen transversarium, and you can see the rest of the transverse process with a broad lateral ending. Now if you come to the attachments, now this is the small anterior arch, this is the upper margin of the anterior arch, this is the lower margin of the anterior arch, and this is the tubercle. Now to this tubercle and to the lateral portions you have the attachment of the anterior longitudinal ligament. This anterior longitudinal ligament is coming from below, it is coming from the body of the axis, and it is getting attached here to its anterior tubercle and the sides of the anterior tubercle, and this depression by the side of the anterior tubercle gives attachment to the longus colli muscle. So you can see here the anterior tubercle, and you can see from below the anterior longitudinal ligament is coming up to be attached here, and from the atlas passing above is the anterior atlanto-occipital membrane. Look at this picture, you can see the atlas here, you can see the atlas here. This is the anterior arch of the atlas, this is the posterior arch of the atlas, and you can make out that from below this is the anterior longitudinal ligament coming over to get attached to the lower border of the anterior arch, and here you have the anterior atlanto-occipital membrane from the upper border of the anterior arch to the occipital bone. And again on the anterior surface of the anterior arch you can make out the longus colli muscle which is attached here, and the anterior longitudinal ligament, it has a medial part, it has a lateral part. You have seen that we have drawn the medial part here much more prominent, We have drawn the lateral part here, and this is the anterior longitudinal ligament. So from below you have the anterior longitudinal ligament coming and getting attached here, and from here passing above you have the anterior atlanto-occipital membrane. If you look at the inner surface of the anterior arch, here you can see the facet. You can see the facet for articulation with the odontoid process of the axis right here, drawn in dotted lines. And now if you come to the posterior arch, the much longer posterior arch, you can see this ligament attached to the posterior tubercle. This actually is the ligamentum nuchae. It is the equivalent of the supraspinous ligament in the thoracic vertebra. So this is the ligamentum nuchae. By the sides of the ligamentum nuchae you can see this muscle, the rectus capitis posterior minor. Not only that, you can make out that from below, this is the arch of the axis, and this is the posterior arch of the atlas. You can see that from the axis the ligamentum flavum has gone up to the lower border of the posterior arch. So here it is. This is the ligamentum flavum over here, and this is the ligamentum flavum over here. So to the posterior arch of the atlas, from below to its lower margin you have the attachment of the ligamentum flavum, and above from its upper margin you have the attachment of the posterior atlanto-occipital membrane. So again, if you look at this structure, from below you will have the attachment of the ligamentum flavum, and from above you have the attachment of the posterior atlanto-occipital membrane. So here you can see them all in section. So anterior atlanto-occipital membrane, posterior atlanto-occipital membrane, anterior longitudinal ligament, and ligamentum flavum. Now on the inner surface, this is the upper border of the posterior arch, and on the inner surface we have seen this sulcus for the vertebral artery, and you can see the vertebral artery which I have drawn over here. This is actually the third part of the vertebral artery. The vertebral artery has four parts. The first part is in the scalenovertebral triangle in the neck. The second part is within the foramina transverse area of the cervical vertebra. This is the third part. This dissection region is actually the suboccipital region, and you can make out that this posterior atlanto-occipital membrane, this one over here and this one over here, it has a free margin on this side. Laterally it has a tough border, and it has an opening, and through this opening the vertebral artery is passing deep and it is rising up into the cranium. So here you can see the posterior atlanto-occipital membrane, and you can see the vertebral artery snaking around by the side, coming deep and rising up into the cranium. So again here on this specimen, this is the sulcus for the vertebral artery. So the vertebral artery is going to come out of the foramen transversarium from here, and it is going to pass into this groove, and by passing, see, you can see the opening here, it is passing into the groove, and it will come out of this groove and it will become the fourth part of the vertebral artery. And here you have the posterior atlanto-occipital membrane, which will have a free margin over here, and through that margin the vertebral artery will go deep. So after the anterior arch and the posterior arch, we come to this articular facets of the lateral mass, and you can see that here lies those small tubercles on the medial surface of the lateral mass for the attachment of the transverse ligament of the atlas. Okay, one thing we forgot to mention, on the sulcus for the vertebral artery there is this nerve. So the first pair of spinal nerves, that is the C1 spinal nerve, which has a ventral ramus and it has a dorsal ramus. The dorsal ramus of the C1 spinal nerve will also pass through the sulcus for the vertebral artery. So this vertebral artery, it will cover the dorsal ramus of C1. So in this groove for vertebral artery, you have the third part of vertebral artery as well as the C1 nerve. And you must remember that along with the vertebral artery, there are these vertebral veins and a network of sympathetic nerves passing along the vertebral artery. So you must not forget the C1 nerve. It's very important. The ventral ramus of the C1 is important, curving around the lateral mass, and the dorsal ramus of C1 is important, passing below the third part of the vertebral artery. Coming back to the lateral mass, we have already seen that these medial tubercles are there, and you have the transverse ligament of the atlas, which we have drawn here. You can see the transverse ligament of the atlas here. It is holding the odontoid process of the axis here. It is holding the odontoid process of the axis here. And this transverse ligament is not all. There is a vertical part to this ligament. There is a superior band, there is an inferior band, such that the whole thing has got a cruciate arrangement. So this is also a cruciate ligament. So you have a transverse band, a superior part of the vertical band, an inferior part of the vertical band, which you can't see here, but you can see it here very well. You can see this superior band of the cruciate ligament and the inferior band of the cruciate ligament, as well as the transverse ligament of the atlas. You can make out that the superior band of the cruciate ligament has gone up into the basilar part of the occipital bone. The inferior band of the cruciate ligament is attached to the body of the axis. Then, just as we had an anterior longitudinal ligament going up into the atlas, you also have a posterior longitudinal ligament coming up on the bodies of the cervical vertebra. Now from C2 or the axis, what will happen to this superior longitudinal ligament? It will pass free as a membrane, a tough membrane called the membrana tectoria, and this posterior longitudinal ligament as membrana tectoria will also get attached to the basilar part of the occipital bone. So you have the superior crus of the cruciate ligament as well as membrana tectoria, which are actually not attached directly to the atlas. But from this transverse ligament, you have a superior crus of cruciate ligament, you have an inferior crus of cruciate ligament, and you have this membrana tectoria. This purple line is actually this, the membrana tectoria, which is supposed to be a continuation of the posterior longitudinal ligament. So all those things you cannot demonstrate in the bone. So you have the head of the axis over here, the odontoid process of the axis. You have the transverse ligament of the axis of the atlas. From that transverse ligament you have a superior band, you have an inferior band. So the transverse ligament of the atlas along with the superior band and the inferior band forms a cruciate structure. And not only that, from the anterior longitudinal ligament you have the anterior atlanto-occipital membrane. From the posterior longitudinal ligament you have the membrana tectoria. Okay. Now let us go to this side, to the transverse process. Let us look at the foramen transversarium. This foramen transversarium, as we have said, gives passage to the vertebral artery. That is the second part of the vertebral artery, the network of vertebral veins and the sympathetic nerves passing over the vertebral artery. And you can make out that this is, although this is complete, some part of this transverse process is developmentally the costal element, and some part of this is the true transverse element. We have tried to make a distinction here. So this little bit of the anterior root, it is the costal element, but the major part of the transverse process is actually the transverse element. So occasionally the costal element may be deficient, so you might have a gap here, like you have in this specimen. You have a gap over here. So the gap is actually in the costal element. Now if we look at the rest of the transverse process, you can see a number of muscle attachments over here. Now these muscle attachments are not important for the exam and they are quite taxing to the memory, so I have already got it written down. So you have the rectus capitis lateralis, you have the superior oblique, you have the inferior oblique on the upper surface, and you have the levator scapulis, planius cervicis and scalenus medius on the under surface. But you don't have to memorize all these things for the exam. They are not important in undergraduate anatomy. I suppose they are not even important in postgraduate anatomy. So much for the atlas. It is quite sufficient, I think. And now if you look at the pattern of ossification of the atlas, you can see that there are 3 centers of ossification, and 1 for the anterior arch and 2 for the lateral masses, which will ossify posteriorly to complete the posterior arch. You can see the center for the anterior arch appears by the end of first year, and the centers in the lateral masses appear by the 7th week of intrauterine life, and the 2 centers from the lateral mass they fuse posteriorly by the 3rd or 4th year, and the center for the anterior arch, which actually takes up a little bit of the lateral mass and the articular facet, it fuses with the other centers around about 6 to 8 years. I think that's enough for today, and in another class we will go to the axis and the 7th cervical vertebra. Thank you. See you.